Now, health workers will start getting their COVID-19 vaccine booster shots in the second Sisonke trial that goes underway on Monday. Now, some of them, however, are concerned about not being afforded the opportunity to choose which vaccine to get between Johnson & Johnson and Pfizer. For more on this, I'm joined by Dr. Mvuyisi Mzukwa, the Vice Chairperson of the South African Medical Association. Doctor, good to have you with us on the Daytime Update today. Perhaps let's talk first about whether or not one can wait in order to have the booster shot, should they prefer to use Pfizer instead of Johnson & Johnson, or is it mandatory that all healthcare workers go ahead and get the Johnson & Johnson shot, whether they like it or not?
Good afternoon, Tammy. Thanks for having us in your program. This is a great question you're coming up with. We know that healthcare workers have received a Johnson & Johnson vaccine early in the year, and they were obviously under the Sisonke study. This time around, we welcome the collaboration between the National Department of Health, the South African Medical Research Council, and also SAPRA, and to come with this proposal of healthcare workers getting a booster. There is evidence that has emerged that if you mix these vaccines, the immune system or the immunity is much higher than the normal booster shots. So in other countries they've done actually this mix and match of vaccines. So I think that's where healthcare workers thought. I mean, in the first place we got a donation. This time around we are getting a donation again. We expect that at least as a token of appreciation, the Department of Health would come with something better, or come with, to appreciate, would really have healthcare workers choose between J&J and the Pfizer. Because, I mean, Pfizer is just there. We've got lots of supply in the country, and we all know that there's not much uptake in terms of communities who are, taking these vaccines. So it was a chance to give a choice to the healthcare workers as an appreciation.
So as it stands now, what is the situation as far as which shots they will be taking?
Well, as it is now, the agreement is that, or what we have, unfortunately we do not have a choice, is that we are going to use the second Sisonke program, to get a booster shot of Johnson & Johnson. It will be only those healthcare workers who have received the first one. Also, the exclusions if you have not been part of the Sisonke, and also if you've got some booster other than Sisonke somewhere else. So you wouldn't really qualify to get into this one. So as we understand it, it has already started yesterday, and we expect it to continue as time goes on.
What are some of the concerns that have been raised by some healthcare workers regarding the current booster shot being given out?
I think the most healthcare workers welcome the booster shot, because we know that we're heading towards December, and our experts have warned us that we might be facing a fourth wave. The challenge is that already we should have started with the booster shots, because we've already seen during the course of the year that the Johnson & Johnson was beginning to wane a little bit down, because we've seen some breakthrough infections with some of our healthcare workers. So the expectation was that it would come a little bit earlier, so that by the time we hit the fourth wave, if it does come, at least we're prepared. Remember that we've lost so many of our healthcare workers, and would want protection at this time around.
From the observations that are being made now, the efficacy of the vaccines as well as how long they actually last in the system, is it likely that there will be booster shots needed periodically for not only healthcare workers but all of those who have already received their vaccinations?
Yes, Tammy, the reason they are bringing the Sisonke program, it is also to test the waters, just to make sure that we don't just willy-nilly come with booster shots for the whole country without any evidence. This is going to give evidence to government that booster shots, they do actually boost up the immune system in terms of the current variants and stuff like that. So it is important that we have the Sisonke program so that it feeds information to the national government for decision making. So that would really help a lot.
Is this booster shot compulsory for all healthcare workers as it stands?
As far as I know, it is not compulsory. But, you'd understand that the employer would always want to protect workers in the workplace. So they will do all what they can to make sure that healthcare workers are protected. I would urge healthcare workers to go for this booster shot so that we make sure that we are protected as we approach the fourth wave, and knowing what we had experienced in terms of our colleagues passing away and all those things. So even though it might not be declared compulsory, but it is very important that we all take the shot.
What we've seen now, there was the Sisonke program, which was a study and a test, and Sisonke 2 now still continues to be a study and the test. What has the general appetite and acceptance levels been from health professionals being part of this mass texting of medication and vaccinations in their systems?
Well, I think from the government point of view, there's a need to educate healthcare workers on the need of this booster, especially because the shots that we've had, they come as studies or as research protocols. So it is important that it is explained that, in the first place, it was, to quicken the process so that we quickly get access to the program. This time around, it is also advantageous that the study is done on healthcare workers, to speed up also access to boosters. Even though it is known that it's the study, but we know that in other countries we already have some evidence, but we wanted it in our own context.
I wonder if you are aware of the delays that are taking place in actually administering Sisonke 2. It was supposed to have already started, but the reports that we're receiving is that this will only now begin on Monday. Are you aware of what the delays might be on that front?
I am not aware, Tammy, but I would understand maybe it could be administrative issues that they're dealing with, in terms of sites and, personnel to administer the vaccine. But I'm not privy to that information.
Dr. Mzukwa, we thank you so much for your time and your insight this afternoon. That's Dr. Mvuyisi Mzukwa, is the Vice Chairperson of the South African Medical Association.